After the age of 60, the body no longer operates as smoothly as it once did, and sometimes silent signals may carry serious warnings. Yet in the busyness and familiarity of daily life, many older adults often overlook small changes in their bodies, assuming they're just an inevitable part of aging. But please take a moment to pause, because certain symptoms that seem harmless, like a persistent mild cough, unexplained weight loss, or lingering fatigue, may actually be early warning signs of serious health conditions, even life-threatening ones if ignored. Internal medicine doctors, oncologists, and cardiologists all agree on one thing. After turning 60, listening to your body becomes a vital life skill. Unusual signs, if detected early, can absolutely help you reverse potential risks, extend your lifespan, and maintain a healthy quality of life. But if delayed, the cost may be prolonged treatments, exhausting hospital stays, or worse, irreversible regret. In today's video, we'll highlight 6 extremely dangerous symptoms that anyone over 60 should pay close attention to. This is not just a medical checklist. It's a powerful reminder that you can actively protect your health, starting with noticing even the smallest details. Don't wait until things become serious to take action. Start today with knowledge, with care, and with deep respect for your own body. Have you ever felt completely drained, even when you haven't done anything physically demanding? You get enough sleep, eat healthily, yet still wake up each morning feeling as though you haven't rested at all? Don't be too quick to blame it on age. Persistent fatigue that doesn't improve with rest may be your body's alarm bell, signaling a serious underlying health issue. Especially after the age of 60, unexplained exhaustion is not just a feeling of sluggishness. It could be a hidden sign of heart disease, kidney dysfunction, or even progressing cancer. The problem is, fatigue is often dismissed or blamed on poor sleep or lack of exercise. But according to experts, when your body enters a state of exhaustion without a clear cause, it's often because a vital internal system is either overworked or failing. The heart may no longer be pumping blood efficiently, the kidneys may be struggling to filter toxins, or the immune system may be battling a growing tumor. The good news is that you can take control if you catch it early. The key lies in actively listening to your body. Don't wait until you're completely drained to see a doctor. If your fatigue lasts more than 2 weeks or is severe enough to affect your daily activities, it's time to act. Getting a full health checkup, especially tests for heart and kidney function, as well as cancer markers, can help detect the problem early and prevent serious consequences. Don't be afraid to ask your doctor questions that might seem minor. Sometimes those very questions can save your life. Imagine waking up one day feeling light and energized. Imagine enjoying peaceful mornings and participating in your favorite activities without your body pushing back. That's not a distant dream. It's a well-deserved reward for those who listen and take action. And once you've learned to identify and respond to unusual fatigue, you'll be better prepared to face other warning signs, such as sudden, severe chest pain, the next critical symptom we'll explore together. Not everyone realizes that a brief episode of chest pain can mark the line between life and death. But the truth is, after the age of 60, sudden chest pain, even if it lasts only a few minutes, can be an urgent warning from your heart. What's alarming is that many people ignore or misinterpret these initial signs. Instead of recognizing it as a heart attack, they mistake it for acid reflux, muscle strain, or simply a fleeting sense of fatigue. And just a few minutes of hesitation can lead to irreversible consequences. Chest pain doesn't always appear as the dramatic, crushing pain you see in movies. Sometimes it's just a feeling of pressure in the center of the chest, spreading to the left arm, neck, jaw, or even the back. Some people may only experience shortness of breath, cold sweats, or dizziness, symptoms that are easy to overlook. Especially among older adults, who often have a higher pain threshold or are hesitant to cause trouble, many choose not to call for help. The reality is, at this age, arteries are often already narrowed due to fat buildup, high blood pressure, diabetes, or long-term high cholesterol. When an artery becomes completely blocked, the heart loses its blood supply and begins to die minute by minute. That's why every second of delay dramatically increases the risk of death. The most important solution, Never be complacent. If you or a loved one experiences unusual chest pain, especially if it radiates to the shoulder, neck, or comes with a tight, suffocating sensation, call emergency services immediately. If you're not allergic, chewing an aspirin while waiting for the ambulance can help reduce heart damage. Never drive yourself to the hospital and never try to tough it out. In the long run, make heart care an essential part of your daily life. A healthy diet, regular physical activity, monitoring your blood pressure, cholesterol, and blood sugar. These are simple steps that can save your life. One moment of listening to your body today can translate into years of healthy, peaceful living with your family. Some things seem as simple as breathing, until the moment it becomes difficult. If one day you find yourself sitting at rest, not doing anything strenuous, and suddenly feel short of breath, your heart racing, or needing to make an effort just to take a deep breath, don't dismiss it. After the age of 60, this could be a subtle sign of serious underlying health conditions. Many older adults have experienced unexplained breathlessness, reassuring themselves with thoughts like, "It's just age," or "I'll be fine after a short rest." But the truth is, those small signs might be the very first warnings of heart failure, pulmonary embolism, or even a silent heart attack, a type that occurs without chest pain and often goes unnoticed. In later years, lung and heart function naturally decline. The heart muscle weakens, blood vessels lose elasticity, and oxygen delivery may fall short, even during light activity. Shortness of breath is no longer normal when it appears during rest, or if just walking a few steps leaves you gasping. That's when action is needed, not when you're already struggling to catch your breath. There are many potential causes of breathlessness. The heart may not be pumping blood effectively, the lungs could be compressed by fluid or a blood clot, or it might indicate infections like pneumonia or side effects from medications. Whatever the cause, one thing is certain. All of these require immediate medical attention. Prolonged oxygen deprivation can damage the brain and other vital organs. You can start by noticing when and under what circumstances you feel breathless, whether it's in the morning, climbing stairs, or even just sitting and watching TV. Keeping a symptom diary and sharing it with your doctor can help detect heart or lung issues early, possibly preventing sudden fatal events. This symptom isn't just a warning for the present. It's also a wake-up call for change. Begin by practicing deep breathing each morning, doing gentle exercises like yoga or short walks. Most importantly, stop smoking and avoid secondhand smoke as they narrow airways and reduce oxygen intake. If you're on medication, check with your doctor for any side effects that may impact your breathing. You may not be able to change the past, but from this moment on, you can choose to live differently. When you cherish each breath, you're telling your body, "I hear you." And that's the first step on the path to living longer, healthier, not just for yourself, but for the people who love you. Have you ever looked in the mirror and been surprised to see that you've noticeably lost weight, even though you haven't been dieting or changed your exercise routine? Your clothes feel looser, your face looks sunken, and yet you assume this is a good thing at your age? Take a moment to pause, because this change might not be as harmless as it seems. Unexplained weight loss, especially when you lose more than 5% of your body weight within a few months, isn't something to celebrate. It's a red flag from your body. After the age of 60, the body's ability to compensate isn't what it used to be. Rapid weight loss can be a sign of serious conditions such as cancer, metabolic disorders, thyroid disease, or heart failure. Unfortunately, many people overlook this symptom. They assume that eating less, sleeping less, or reduced activity naturally leads to weight loss. But the truth is, when weight drops without a clear cause, your body may be silently battling a serious illness that you haven't yet detected. And if left unchecked, it can lead to both physical and emotional exhaustion. This is the time to shift your perspective. Unexplained weight loss is not a lucky break. It's a cry for help from your digestive system, your thyroid, your liver, your immune system, all struggling to maintain balance while a hidden crisis brews within. Waiting won't make you better. Timely action is the key. The first step is to see a doctor. A comprehensive checkup, abdominal ultrasound, Thyroid function test and nutritional assessment can help identify the true cause. If caught early, many of these conditions can be effectively treated. Early-stage cancer, hormonal imbalances, and metabolic disorders are all manageable with timely diagnosis. In addition, keep track of your daily food intake, appetite levels, sleep quality, and emotional state. A prolonged loss of appetite or disinterest in food is also a warning sign. Don't hesitate to consult a nutritionist to build a suitable diet plan that enhances absorption and ensures you're not deficient in essential nutrients. Imagine having a healthy body again, where you can confidently wear your favorite outfits, enjoy gatherings, travel, and engage in light activities without feeling drained. Recovery is within reach. All it takes is a deeper level of attention to your own well-being. When viewed correctly, abnormal weight loss is not just a warning, it's an opportunity to turn the page to a new chapter, one of awareness, intentional care, and empowerment. And from here, we continue our journey of recognizing other serious symptoms, such as sudden changes in memory, thinking, and behavior. The next troubling sign you shouldn't ignore. Has it ever happened that you, or someone you care about, suddenly forget basic things, like a familiar person's name, a well-known route, or how to use everyday objects? Have you noticed someone becoming unusually irritable, snapping without reason, or quietly withdrawing even though they used to be sociable? If the answer is yes, you may be witnessing one of the most concerning signs of aging, sudden changes in memory, behavior, and emotions. It's easy to brush these signs aside with explanations like, maybe they're just tired, it's just part of aging, or they're just in a bad mood today. But in reality, these may be warning bells. Neurological changes after age 60 are not always temporary. They may signal serious conditions like mini-strokes, brain infections, neurodegenerative disorders, or the early stages of Alzheimer's disease. The danger lies in how quietly these symptoms begin. Unlike chest pain or physical fatigue, cognitive decline often starts subtly, making both the individual and their loved ones underestimate the problem. But over time, confusion grows. Disorientation in time and space becomes more obvious, and the person's personality may change entirely. Cheerful becomes suspicious, calm turns aggressive, and lively becomes withdrawn. These symptoms can stem from various bodily systems. Reduced blood flow to the brain due to atherosclerosis, brain inflammation from infection, neurological tumors, or abnormal protein buildups such as amyloid, all can affect memory and behavior. In addition, medications for chronic conditions may have side effects that impair cognition. When faced with these realities, the first step is not to ignore or hide them. If you or a loved one shows signs like forgetting familiar names, losing orientation, struggling to find words, or experiencing unexplained emotional changes, seek medical help from a neurologist. Memory assessments, brain MRI scans, and blood tests can help detect issues early before they worsen. At the same time, adopt a brain-friendly lifestyle. Read regularly, solve puzzles, maintain social interactions, and eat a balanced diet rich in omega-3s and antioxidants. Consistent, quality sleep is also critical, as the brain needs rest to clean up harmful waste that accumulates daily. You don't have to wait for severe symptoms to take action. Even small changes in memory or mood deserve attention, because sometimes they're the last chance to intervene before a neurodegenerative condition takes hold. And remember, a sharp mind is essential for a fulfilling life. Protecting it is not just a responsibility, it's a way of preserving your quality of living, awareness, connection, and the capacity to love. Start today by paying attention to the smallest shifts and never underestimate the importance of mental health in old age. What seems like a harmless stomachache might actually be your body's final warning, especially when the pain doesn't go away, spreads, or comes with fever, nausea, or unusual weakness. This is no longer just a digestive issue. After the age of 60, persistent and severe abdominal pain may indicate a serious medical condition that requires immediate attention. All too often, older adults tend to endure the discomfort, thinking, it'll get better in a few days, or it's probably just indigestion. But that mindset is exactly what makes it dangerous. Serious conditions like an abdominal aortic aneurysm bowel obstruction, acute pancreatitis, or gallstones can all start with a dull abdominal ache before escalating into life-threatening emergencies. The problem lies in the fact that classic symptoms may not appear as expected in older adults. Sharp pain, cramping, or high fever may be muted because the nervous system becomes less sensitive with age. That's why if someone over 60 describes a nagging ache for hours or a strange feeling in the stomach, we shouldn't dismiss it. In fact, it's the vagueness of the symptom that makes it especially concerning. The underlying causes could come from multiple systems: a ruptured or bulging blood vessel, intestinal blockage due to a tumor or scar tissue, an inflamed pancreas caused by infection, or a blocked bile duct. Each of these conditions carries significant risk, and the later it's diagnosed, the worse the outcome. The best way to protect yourself is to never ignore abdominal pain that lasts more than a few hours, especially if it comes with symptoms like severe indigestion, yellowing of the skin, black stools, or the feeling of abdominal tightness like a drum. Go to the hospital immediately, ask for an abdominal ultrasound or CT scan if needed, and describe every symptom you're experiencing, no matter how small. Over the long term, you should actively support digestive health by eating a balanced diet. Limit fried foods, increase vegetables, and fiber-rich foods. Most importantly, eat smaller meals, stay hydrated, and take light walks after meals. Simple but powerful habits to prevent digestive disorders and protect your liver, gallbladder, and pancreas. Abdominal pain should never be underestimated, especially when you're no longer in your 30s or 40s. After 60, the body slows down, healing takes longer, and even mild symptoms may signal a serious internal crisis. Learn to recognize what's normal for your body and what feels off, because that distinction could mean the difference between a simple treatment and an emergency surgery. And above all, remember this: today's vigilance is tomorrow's insurance. Listening to your body, especially when it's whispering for help, is the smartest step you can take to live well, live consciously, and live with dignity through every year you've been gifted. Old age does not mean silence or helplessness. It can be the most beautiful time to slow down and live more deeply if we learn to listen and care for ourselves. The 6 seemingly simple symptoms we've just explored are, in truth, powerful messages from your body whispering, "I need you." We cannot escape the passage of time, but we can absolutely choose how we move through it, with awareness, with intention, and with love for ourselves. Every decision to seek timely medical care, every small lifestyle change, every moment you pause to ask, "How do I feel today?" These are the choices of someone who lives with courage and responsibility. Health is not something to take for granted. It is a precious gift you must protect each day, with knowledge, with patience, and with compassion for yourself. And if today you choose to act, to schedule that checkup, to pay closer attention to each small sign, know that this choice is not just for you, but also for those who love you. Because you deserve years that are not only long, but also full of peace, of joy, and of meaningful living.